Adopting a kitten is an exciting experience, especially if it is the first time you have lived with one of these animals. However, adoption involves different responsibilities such as feeding, mental stimulation, and their overall health. When it comes to feline health, trips to the veterinarian are essential, but when should you go? In this Animal Wise video, we explain when you should take your cat to the vet for the first time, what will happen during the visit, and how follow-up should work. Regardless of whether you've adopted a kitten or an adult cat, if you do not have other animals in the home, it's advisable to wait a week before visiting the vet. In this way, the cat can get used to your presence and feel less cautious when visiting the specialist. If you do have other animals, you will have to take it as soon as possible or keep it separated from the rest in case they have parasites or any pathologies. If you've adopted a kitten, you should know that the first visit to the veterinarian should be made after 7 or 8 weeks of life, the ideal time for a first checkup. After 3 months, the first vaccinations are administered and boosters are given 3 months later. After vaccination and deworming, it's advisable to visit the vet every 6 to 12 months to perform a follow-up examination. The first visit to the vet is essential to forge a link between the feline and their specialist. The first thing the veterinarian will do is record the data of your pet, such as name, origin, diet, or any other potential inherited pathologies from their parents. This is helpful in knowing of potential diseases in the future. Afterwards, the veterinarian will proceed to make a general review of the cat. They will check their eyes, ears, teeth, and coat, the latter for external parasites or injury. They will listen to the lungs and heart, measure and weigh them. If you do not know the age of the cat, the veterinarian can provide an approximate figure. During the first visit, an antiparasitic product will be administered and the correct start date of the vaccination schedule will be determined. Also, depending on the health status of the cat, they may require some additional health tests. As we've already stated, the first consultation with the vet will involve deworming. Before starting the vaccination schedule, it is advisable to wait a few days so that the deworming product doesn't interfere with it. The most important is the feline trivalent vaccine, which protects the cat against feline panleukopenia, rhinotracheitis, and calciviruses. Some 3 to 4 months later, a booster of this vaccine is given and then repeated annually. When the cat reaches 5 months of age, it's also recommended the feline leukemia vaccination is given and one for rabies at 6 months. In addition to visiting the specialist for the first administration of vaccines, it's important to visit them in the following circumstances. If you observe external parasites such as fleas or ticks, if they've been the victim of trauma, if they have not eaten for a day or 2, if they have a fever, if they urinate blood or cannot urinate at all, if they have vomiting or diarrhea for more than 24 hours, if they do not defecate or have blood in their stool, if they seem dehydrated, if they stop grooming or their hair seems disheveled, if you think they have been poisoned, if their behaviour changes suddenly without reason. If the proper measures are not taken, going to the veterinarian can become a traumatic experience for the animal. Therefore, we recommend you have a carrier for animals, get your cat used to the carrier days before the visit, use pheromones for cats if they get nervous or spray around the carrier, ask for an appointment so the animal waits as little as possible, scratch their head, chin or ears to reassure them, speak to them in a low and affectionate tone of voice if you notice they are nervous. Now that you know when to take your cat to the veterinarian and how to do it, don't forget to set up a visiting routine with a specialist.